Hi, my name is Toyin Nwafo, Dr. Toyin Nwafo, and I am Senior Medical Director for HIV Prevention at ViV Healthcare. Prior to joining ViV Healthcare as an infectious disease physician at Cook County Health and Rush Medical College in Chicago. So I've been in the field of HIV treatment and prevention for over 2 decades now, and really committed to the passion for taking care of people living with HIV or who could benefit from HIV prevention. So in my current role at ViV Healthcare, I get to do that, especially in the space of HIV prevention. So my journey to medicine, I've known I wanted to be a physician probably since 2nd grade, actually, because I remember writing what do you want to be when you grow up? And that really had to do with the role models and people that I had in my life growing up. And I had a pediatrician who was just this phenomenal woman. I just wanted to be like her. So that was kind of my initial thought about going into medicine. And again, like I said, I graduated medical school almost over 30 years ago now, 1992, and have always been in the field of infectious diseases and doing HIV work both in the clinic, in the hospital, and also as a researcher. So I got to educate the next set of healthcare providers, students, residents, fellows, got to do research, got around in the hospital, take care of people in the clinic, but also continue to be an advocate for people. So I love community work, I love empowering people, and I love being part of the people who are working to end the HIV epidemic. So I enjoy what I do, and in the clinic, in the hospital, in my current company, in whatever role I'm in, I'm committed to HIV and just being a part of taking care of people living with HIV. It's been a while.
Dr. Toyin, you mentioned HIV prevention.
Yes.
What's changed in HIV prevention over the years, and what do we need to know? What's going on now?
Yes, so we are fortunate. So we've had really great HIV treatments for a while. And in the last 10 years, a little over 10 years now, we've had options for HIV prevention in terms of biomedical medication to help with HIV prevention. And then more recently, we have even more options. So options in terms of a toolbox to help people who test negative for HIV to stay uninfected and negative. And so we have things like pre-exposure prophylaxis, and the option includes a pill that people can take every day or injectables that they can take every 2 months. And the field and that toolbox is growing to be able to have options for people after taking an HIV test to be able to make informed decisions about what they need to do next. So the field has changed dramatically in the last 10 years, but we do know that despite that, we are still seeing disparities in terms of new HIV infections. And just a little bit of stuff, we know that half of the new infections in the US are still happening in the South. We know that more than 40% of new HIV infections are in Black Americans, and 1 out of 5 infections are in women, of which half of those or more are in Black women. So while we have the tools and increasing tools for HIV prevention, we still have disparities in who's getting diagnosed with HIV, who is accessing these prevention tools, and there are a variety of reasons for that. So one of the sessions we had at this conference was really talking specifically to healthcare providers about how we can work to reduce those disparities and really talk about HIV prevention in Black women who've been left out of this conversation for so long.
Wow. So what do you see that just the everyday person, what can we do to help turn the tide, change these numbers, and start going into a positive direction?
Correct. Thank you so much. The first thing, and I'll start by addressing my healthcare providers, because the session we had today at NMA was with healthcare providers, because healthcare providers play such a critical role in this message around HIV prevention. For too long, that message was left to the infectious disease doctors like myself. But we know that prevention is primary care, one, and that sexual health is a part of overall health. We talk about our physical health, our mental health. Well, sexual health is part of that conversation. And for too long, healthcare providers left that part out of the exam room unless a patient brought up something or they had a problem with their sexual health. Now, the whole thing about risk to reasons is that we are taking away the language that is stigmatizing, that is traumatizing, that further moves people away from the message of prevention to reasons why they would benefit from HIV prevention. And those reasons are reasons that were developed by Black women, for Black women, of cis and trans experience. Reasons rooted in intimacy, pleasure, and desire. Reasons rooted in power, control of your circumstances, and taking care of your own sexual health. And reasons of normalizing your sexual health and wellness as part of routine care. We do it in other aspects. So the whole thing about risk to reasons is reframing risk, using language that is positive and empowering so that women take charge of their sexual health and actually can make informed decisions about how to protect themselves as a part of wellness. So that's our sexual health messaging to our healthcare providers, like, let's normalize these conversations in our spaces, regardless of what your specialty is. If you're in primary care, you're in gynae, you're in family medicine. This conference has people from all different parts of healthcare team, that we, as we're seeing patients, to normalize sexual health conversations, to make sure that we're offering HIV testing. But to do that, we have to have spaces that are safe. We have to use language that is non-stigmatizing, non-judgmental, language that is empowering, right? And so that's what we're doing. And the Risk to Reasons initiative is fantastic because it has activities and workbooks that help women to communicate with their partners, to communicate with their healthcare providers, and sample messages that healthcare providers can use if they're not really comfortable having those conversations. So that's the healthcare team. For everybody else, for those of you in media, it's really important that you share messages and tell stories about women and HIV, stories that are empowering, that are inspiring, and that are not, that continue to embrace and actually support people who get out there and get an HIV test or make a choice to go on prevention, because that's actually a sign of wellness. And then for the general population is everyone understands that for us to end the epidemic, we have to take away the stigma that comes around with the word HIV treatment, HIV prevention, and that stepping out and getting an HIV test is actually the best thing you can do. It's actually taking that first step, because once you have an HIV test, then you can know what your options are to remain HIV uninfected. And if you are living with HIV, to get in treatment, get in care, get your virus undetectable so you can live a healthy life and also not transmit to your partners. So again, for everyone else is no stigma, embracing people and getting us to all get an HIV test, and really making sure that when we get messages and we understand about getting an HIV test, to encourage other people to do that. Let's share that message about HIV testing, sexual health, because sexual health is a part of our overall health. And we need to talk about it.
Yeah. Ooh, that's so good. That's so good. Okay, last question. You are an incredible Black female doctor and a young person looking at this video today who may be going down the road in primary care, healthcare, in some aspect. What would you tell her, or what would you tell your younger self?
Oh, I love that question. Let us to your younger self is that know that you are more than enough. And I say that because there are going to be challenges along the way. There are going to be times where you feel like the struggle is real, and it is real. But know why you're doing this, why you're in medicine, why you're in healthcare. And know that our words matter, and that it's important to know that you are more than enough, doing your best. But also never forget to take care of yourself. So as we talk about normalizing sexual health and normalizing self-care, I'll tell my younger self to take care of yourself, because you can be a better, more effective person when you are well. And so to never let medicine make you forget about taking care of yourself.
Wow, wow. Great. Well, ladies and gentlemen, you've heard it here first at the National Medical Association Conference 2023. Thank you so much, Dr. Toyin. Thank you for joining us, everybody.
Thank you.